Hi, this is Dr. A, and I'm here with your lecture on automation in the laboratory. We're going to obviously talk more specifically about the clinical lab, but we're just going to talk about automation in general. Okay, so some of the goals of automation was first to deal with the increased volume of tests. So as laboratory testing got more and more popular because it's given objective data that physicians can make decisions on, more and more tests were being ordered, new tests were coming out, and all of that. And so there's just been always an increase in the volume of tests that have been performed. And so one of the first phases of testing that was automated is the analyzers, the analytical phase, so that we can get these high volume tests done as physicians were ordering them more and more. Okay, also, one of the good things with automation is it has delivered an increased precision and accuracy because basically the more you can take out the human factor out of the equation, the more precise and less errors are going to happen. And not saying that it's flawless, but it is a lot better. So obviously automation first, we first applied it to the analytical process, and that's how we came out with all the different analyzers that you can find in the laboratory. And then I started moving it to the pre-analytical phase because that still ended up being a big source of error. There's still a human factor because you still need a human to go draw blood from blood specimens from the patients and stuff like that. But really, like the specimen processing and all of that can be automated, and so that is allowed also for a reduction in errors. There's also a decreased exposure of lab personnel to pathogens and stuff like that. So just think if you have an automated system that's uncapping tubes and loading them, and all that's done, in the analyzer behind a shield where you have no exposure, then that's much safer than if you are yourself uncapping and maybe something aerosolizes and then you breathe it in. So safer for our lab techs that are out there. And then for a long time, laboratories could be seen as revenue generators. So that was especially true, for one, if you can increase your capacity of your volume testing, and so you can do more tests in less time. If you are reimbursed per test that you've done, then you can generate actually profit for the hospital or for the reference lab and stuff. Where in a lot of the hospitals where this is no longer true is the reimbursement model has moved away from a fee-for-service model where basically you bill the insurance company or Medicaid or Medicare for everything you've done to the patient and they just pay you back. And they used to not even question it. So that led to a lot of test ordering, a lot of unnecessary test ordering, sometimes doing some tests every day, even if there really wasn't a need for it, etc., because it could generate income for hospitals and stuff. Now your reimbursement structure is more so, some of it's outcome-based, and then some of it is you get X amount of dollars to manage like a patient population, or you get X amount of dollars for a specific type of case when that patient is hospitalized, and that's your budget, and that's how much you get, and you have to operate within that budget. So then you have to not be wasteful, or if it costs you more to manage that patient, then you have to, it's a loss for the hospital, you have to eat that cost. And so then in that kind of scenario, then laboratories all of a sudden have become more of a source of expense. And so proper test utilization and all of that, and testing utilization reviews have all come into play in that type of payment model. But it used to be a big revenue generator in a model where you're paid, reimbursed per test that you have done. All right, first type of analyzer automation that we're going to look at in clinical chemistry is the continuous flow analyzers. So an example is a Technicon auto analyzer. The reagents are pumped nonstop through the system, and it uses peristaltic pumps to move fluids through tubings. And then it uses a system of just generating bubbles between samples, or between, let's say there's a sample, a wash, and then a bubble, and then a sample, a wash, bubble. So the bubble separates the samples. So many advantages and disadvantages of that system. You can run numerous tests on numerous patients in one run. There is a problem with carryover. So if something, a substance, an analyte, was sticking to the tubing, sometimes the wash was in between, that's in between, is not enough to remove it, and then it would contaminate the following specimen, and so that's called carryover. All tests are performed no matter what test is ordered. This reminds me a little bit of the hematology analyzer for CBCs. So in those types of analyzer, when you run a tube through it, it runs all the tests. So it runs the CBC, and all times the CBC and the diff, regardless if the physician ordered if it's CBC with diff, a CBC, or just an H&H. It just runs all the tests. So that gives you kind of an example there. And then the maintenance on the system tended to be extensive. So this short little video just shows you what a peristaltic pump is. And so you can see it uses, this is a peristaltic pump. It rotates and pulls. You have to, obviously, a lot of times you have to pump the system fluid through the tubing, and so it's continuously moving. So this could be, sample, it could be reagent, it could be whatever, and then you have a system of a bunch of those with a bunch of tubing throughout the entire system, and that's how you can see it's pulling the fluid through. So that gives you an idea of what that looks like. And then, so this is an example of a continuous flow analyzer. I know it's kind of hard to see, but you'd be loading, it'd be sampling stuff here, but then you can see the system of tubing and peristaltic pumps and all of that. It's just one example. Again, not used widely in a clinical lab. Now, centrifugal analyzers, they have a rotor compartment, so something that spins, right? Rotor, right? And a centrifugal force is used for the reaction. So it mixes the reagent and sample into one cuvette, and then it uses centrifugal force to mix them. So usually it's the ones I can think of, like when I'm showing you the Piccolo, it's got a cartridge, you load the sample, and then there's reagents dotted across around the cartridge. And when it spins, it separates the serum, and the serum goes and mixes with the reagent, and the reaction happens. And then it uses a spectrophotometer to read a color change reaction and give you your absorbance and concentration on your various analytes. A lot of time, the cartridge itself is a panel, and so you have to pick the right cartridge for the test that you want to do. It does produce results quickly, but you only perform one test or one panel at a time, and on one patient at a time. And so this is definitely not a high volume type of scenario, at least the one that I'm thinking of. So anytime you can only do one test at a time, and you can't do multiple all at the same time, the testing process is going to be slower. But if for example, the Piccolo is used oftentimes in vet offices or in small clinics and stuff, where you can get the results quickly while the patient waits, but you're not trying to run a whole bunch of them at a time, so it's okay that you can perform a bunch of tests at a time. Usually you run the panel that you need on the patient. 10 minutes later you have your results, or 15 minutes later you have your results. You can go consult with your patient right there and then send them on their way with whatever it is that they need. So here's an example. This is the Piccolo. We got this in our little lab, so we're going to use it. But basically you can see here where you would load the sample. This is the sample well. And then you load it in here in this tray, and then it's going to spin it, and the reagent, the sample is going to be distributed throughout the system here and hit up the reagents that are distributed across here, and then they're going to mix and going to enter into the detection cuvettes, and then their concentration is going to be read. So that's centrifugal. And then the discrete analyzers. So these are really the format of the big analyzers that you would think of when you think of a big chemistry analyzer. You have a separate reaction vessel for each specimen in each test. A lot of times that reaction vessel could be a cuvette, could be a built-in cuvette that's rewashed, or it can be a disposable cuvette. So it can allow for a single test to be performed on multiple samples, or multiple tests on one sample, or even multiple tests on multiple samples. Okay. It has random sampling, meaning that you can load a bunch of different samples with a bunch of different tests, and it just goes through and samples what it needs in whatever order the analyzer decides which one to sample first and all that for the most efficient use of time and getting these results out. And a lot of times these analyzers are an amalgamation of different test methods. So there's usually some spectrophotometry modules on there, an immunoassay module, chemiluminescent module, ion selective electrodes, and all of those are linked up on this analyzer, and you just load your specimen and it can run all of these different tests on there. So their testing menu on discrete analyzers are quite extensive, and they can usually handle high volume of tests. So this would be an example. A lot of times they're floor models, but you can have discrete analyzers that are smaller tabletop type models also, or countertop. So I'm going to play this video and just give you some commentary. I can link it on in the bottom in the comment, not in the comments, in the description. But this shows one of those types of analyzers in operation. And I do warn you. Okay, so they have the hood open and they have it like open in a certain way where you can see what's going on, but it obviously doesn't operate open. It should be closed when you operate it. So. Let's start this video. It's only a couple of minutes. And so it's a biochemistry analyzer because that is what they call them in the UK. Okay, and so you can see, I'm going to do a voiceover because it's probably not going to pick up. But these are the reagent areas, reaction areas, and then here's where your samples are. As you can see, there's a lot of things going on at one time. There's sample probes here that are sampling. There's another sample probe here that's picking up stuff and doing reactions in there. These are reagent areas too. And they're here. Those are reagent probes that can pick up reagents. And there's this turntable here has a bunch of cuvettes that are being washed by this system right here. And it washes it and dries it, and then you start over. And then not seen underneath the machine is the spectrophotometry module that's going to be detecting the reaction that's happening in a lot of these cuvettes and stuff like that. So anyway, I'm not going to play the whole video, but you can see kind of how this works. So reagents are here, reactions happen here in cuvettes, these probes sample reagents and stuff. This probe right here picks up samples, so your sample tubes are here in this area, and then this one is also picking up and doing reactions over there. Anyway, so that gives you an idea of what this automation stuff looks like when it's actually running. So random access and batch analyzers. So there's another couple of definitions you need to know. A random access offers options. So the instruments usually read specimen barcodes, and the specimen barcode has patient information and what tests are to be performed, and it only will perform what is ordered, what it reads on the barcode. And so you can keep loading samples and stuff of all kinds of different tests, different specimens of different patients and all of that. As long as the analyzer is programmed to do it, it can read the barcode and do it. A lot of the discrete analyzers pretty much are random access, so that kind of goes in tandem. So basically, if you can load samples and it starts sampling and running the test and then come back even before that testing is done and load more samples, and then come back like a few minutes later and load more samples, that's random access, and it uses usually barcode reading to know what to do with all your samples and stuff. Batch analyzers can also have barcode readers and all that, but they usually perform one test on many samples. So one of the ones that I think of right away when I think of batch analyzers in chemistry is the parathyroid hormone testing. So it used to be just one little analyzer, and you would save up all the tests over the weekend or for the last 24 hours, whatever you had. They would put them in the fridge, and then that morning they would come and they would load the reagents, calibrators, QC, anything that needed, plus all the samples, and then you load all of that, and that's what it's running. It's just running parathyroid hormone testing, and that's the results that you get, and that's it. And so again, they tend to run in batches, And while that batch is running, you cannot add anything else to the testing process. You have to wait till the batch is complete before you can run another batch. Usually, batch testing is better for tests that aren't ordered as often and that aren't like critical, that you have to have results really quickly, where it's okay to save it for 24 hours and for the physician to wait a day, or two, if it's over the weekend, for the results. Okay, so if you're in class in neuropod activity, you're going to answer which analyzer uses bubbles in the tubing to separate samples, and then you're going to answer the question also, which analyzer can analyze multiple specimens and multiple tests at one time. Okay, and so a little bit on automating really specifically in clinical chemistry. So the term fluidics refers to the movement of the samples and the reagents throughout the analyzer. In the video I just showed you, you saw probes picking it up and stuff like that, and usually there's tubing and pumps and it's sucking it in and then dispensing in it and all of that. And so anything, all of those tubings and all that with fluid, whether that's fluid as the specimen or the reagent or wash, whatever, that's fluidics, okay? In automated clinical chemistry, you have some systems are wet systems and some systems are dry systems. If it needs to be connected to a water supply, usually through a millipore and all that, and has to have a drain, then it's a wet system. If it doesn't, then it's a dry system. So within the phases of automating clinical chemistry, we're going to talk about specimen processing, reagent handling, optics, and detection methods. And we're going to cover that here one at a time. But in the meantime, I want to show you another big analyzer. So again, this is a random access discrete analyzer with a bunch of different modules. I will link it also in the comments. This is a Vitros one, and so it's widely used. So they're doing a little bit about automation in the lab and testing volume, etc. And let me actually go where it can go. So this one's on the 5600. Right, so this is what it looks like again. Big, lots of different modules and stuff in there. And so it has different types of technology that it explains. It does increase your productivity. Big testing menu, high quality. You can see she's loading reagents. She's loading samples in there, and reagents also in another port. You can see all the testing menu. You can program sample. Of course, a lot of that's barcoded. These are reagent packs and stuff. You can load it in. And this one is a dry slide. You can see it running. It has an immunoassay module, etc. So you can see now a little bit all the inside of it that you normally don't see while it's running, picking up, dispensing, all of that. You see the barcoded specimens, so it knows what to do with it. This is a small sample cup. Sometimes they have a small volume. You have to put it in that type of adapter. It's picking up reagent tips here, right, and then disposes of it. You can see all kinds of cool stuff going on. Anyway, it's slide technology, which is really cool. We're going to talk about that here in reagents. So small volume, lots of testing, big menu, kind of neat. You can see that. Okay, so let's first talk about specimen delivery. So this has to do with getting a specimen from the patient to the lab, to the testing facility. And so this can look different depending on the type of facility you're at and what's going on. So if you work in a hospital, a lot of times simply the phlebotomy team is in charge of getting the specimens back to the lab. If it's a smaller hospital, the phlebotomy team sometimes even has techs on it where you would go out, draw blood, and then bring it back to the lab, processing it in, and then run the tests and stuff. Some of the hospital systems have pneumatic tube systems or even robots that you can use to deliver specimens from one area of the hospital to another area of the hospital. This is especially useful in really large hospitals where you have a huge phlebotomy team and they may be assigned to, several floors, and that's just where they work. And the lab is a long way from there, and so the pneumatic tube system is a lot faster to send things back and forth in the hospital. Couriers can be used too, so this will be more what happens when you are sending testing samples to like a reference lab, or maybe you're a reference lab or you're a bigger lab and they're bringing specimens in from clinics and stuff like that. So couriers usually are people that are moving the samples from collection sites to testing sites, usually in cars or vans and that kind of stuff, and they make sure that they're it's appropriately refrigerated and transported to the location that it needs to go to. Okay, so then when it gets to the lab, it needs to be processed in. And so this specimen handling is all in the pre-analytical phase still, and some of that can be automated. And so there's been some automated specimen processors that have been integrated into the lab. But some of the things that have to be done usually for specimens that go into chemistry is, one, a lot of times there need to be centrifuge. So that would apply to pretty much all your plasma and serum samples. The only test that I can just right off the bat think that we would need to do that would be your A1C. Your hemoglobin A1C is usually done on whole blood. So everything else, it needs to be centrifugated for the proper amount of time for that type of specimen. Obviously, your specimens have to be identified and loaded onto the analyzer. And so the system that is widely used is the barcoding system. A lot of times the system has it such where your orders for testing already have the barcode, and when your phlebotomist collects the sample, they put the barcode as part of the label of the tube. And then usually all you have to do is you just load it on the analyzer, and the analyzer reads the barcode, provided the specimen has been checked into the system. So some of that can be automated. So if you have a specimen processor that's automated, you can actually simply put all your tubes in there, and it will, read the barcode. It will centrifugate all the ones that need to be. It will send it then on to the appropriate department if it's linked to the other analyzers and stuff, and load it on that analyzer. There are aspiration probes, so within the specimen processors that we can check for clots and problems that would interfere with testing. But then, of course, once it's been loaded on the analyzer, as we saw, a lot of those probes that were going, back and forth like that and sampling, they would aspirate the sample and then deliver it to the reaction vessel and stuff. So, yeah, the delivery of the specimens, this is, part. Also, you can have delivery can be interpreted as delivery to the analyzer, or once you're in the analyzer, delivered to the cuvette system reaction module and stuff like that. But usually this whole specimen processing has to do with everything that has to be done to the specimen before the analytical process starts, where it's actually starting to measure stuff. So, yeah, chemistry, centrifugation. Usually there's an uncapping also. Most chemistry analyzers need to be have open tubes. They're not tube piercing analyzers. So that's a process that has happened too before the testing can begin. So a lot of the automated chemistry analyzers have a system for reagent handling. Reagent storage is important. This is before it's loaded on the analyzer, and then of course once it's on the analyzer, it has to be stored at the right temperature, so it needs to be refrigerated. Maybe there's a reagent wheel there that's all the refrigerated stuff. It has all kinds of different formats. So there are slides, there are liquids that have to be reconstituted, and it just varies from one analyzer to the next. All reagents are usually barcoded with what they are, lot number, etc., so that you can see. You usually want to stick with the same lot number that you've been on and not switch. Obviously, we saw also there was a system of probes in the analyzers to aspirate the reagents and deliver it to the cuvette where the reaction is taking place. So that's a reagent delivery system. So usually, like I said, usually it's some kind of probe or something, but it has to be able to get the reagent from its containment format or whatever, whether it's a cartridge or a slide or whatever. Well, the slide system is everything happens into one slide, but we'll talk about that here in just a second. But it has to be able to pick it up and then get it to the reaction where the reaction is happening, where your specimen is going to be added, and all of that. So yeah, you have to use the reagents that are provided and made for your specific analyzer, and obviously abide by all the rules, all the stuff. So some of it might be able to be stored at room temperature. Some of it, usually it's refrigerated. Some of it might have to be frozen and thawed out and stuff like that. So 99% of the time it's just going to be refrigerated, but you have to know what to do with them and how to load them properly so that your testing process can happen, keep going on. All right, so if you send a specimen to the lab via a pneumatic tube system, which part of the phase of automation is that? So select and answer that. And then in your chemistry analyzer, you have all the optics system. So this has to do with the detection of the reaction, and so there's usually a light source involved, like different types of lamps that we talked about in the automation chapter. In the instrumentation chapter. You do have to have a system that can mix the sample and the reagent. This can vary. Some systems, the wheel rocks back and forth and like this little shaky motion. Some of them have little paddles that can go into the cuvette and just mix it up. But somehow you have to be able to mix the sample and the reagent real well so the reaction can happen adequately. And the timing of what gets added when, and for how, plus the incubation and when it's read and all that is all controlled by the analyzer, and it's all depending on what's been ordered, what's running, and all of that. And the analyzer is really good at keeping it running efficiently, so that it's kind of like if you're cooking the meal, it will start on the things that take the longest first, so that can get going. And so that everything is, ready, hopefully around the same time. Sometimes some of the tests may only take 30 seconds to run, like some of the ion selective electrodes are really quickly run. Some tests may take 10, 15 minutes or even longer. And so the analyzer will time all that to have the most efficient use of all the cuvettes and all of that, and the detection modules. There is also temperature regulation that is going on in the testing phase. So if a test has to happen at body temperature, a lot of the enzyme tests have to happen at body temperature, then there's going to be preheated cuvettes and stuff that where the reaction is maintained at 37. If you have a variation in that temperature, then you can have problems with your testing. And then the cuvettes is where the reaction takes place. Some systems, the cuvettes are disposable. Some systems, they are reused, they're washed and reused. And so that just varies from one system to the next. The detection methods, so it's pretty much parallels the instrumentation. Here is the slide method, so I just wanted to show you that one. It uses reflectance photometry. So on the slide methods, the sample is added on one side of the slide and it diffuses through, and then it meets with the reagents and stuff, and then has a color reaction, and a color reaction can be visible here on basically what we see at the bottom of the slide, and you can see the red lines. It's like the light is shone onto the color, and then the color of that slide reflects the light and to the color that it is. And the intensity of the color is correlated to the concentration. So the Vitros has a slide technology, and spectral photometry converts the absorbance into a concentration. We've talked about how that works with a light source that shines through a cuvette. Fluorometry we talked about is like emitted by a fluorescent molecule that's usually tagged. It's usually in immunoassays. And so you shine light at one angle and it detects light emitted at a different angle. Turbidimetry and nephelometry, again, usually part of immunoassays. The turbidimetry uses a photometer. It just shines light through the cuvette and detects the light transmitted on the other side and determines how turbid or cloudy the specimen is, and that relates to the concentration. Nephelometry is light scattered. So again, light shone, and then the particles, antibody antigen particles, reflect light, scatter the light, and that's what's picked up. Chemiluminescence, it's a chemical reaction that generates light, and that is detected by phototube. And then your electrochemical methods like your ion selective electrodes and all of that. Those are all the types of detection methods that are used for the different reactions. Your next poll question for Nearpod is true, false, a random access discrete analyzer would have multiple detection methods on board. And I just saw a little typo there. Y'all just ignore that. I will fix it. All right, and lastly, you have to be able to manage all the data that's generated. And so one of the first things that's not even listed on here is when you get those signals of absorbance or cloudiness and all of that kind of stuff, whatever's detected, then that has to be converted into a concentration, usually, milligrams per DL, international units per liter, something like that. And that is done by the onboard computer based on the calibration of that analyzer for that specific test. But then once it generates all your results for your patient, for that panel or that test, the patient info with the test and the results enter the lab information system, which is a separate computer system that's linked to the onboard computer system. So there's an interface there. And that interface is a two-way interface, so it allows the results, the completed results to cross over to the lab information system, but also the ordered test to go from the lab information system to the onboard computer, so that when it reads that barcode and sees that specimen numbers from the patient, it knows what to do. The LIS sends it, okay, this barcode, you got to run these tests. And it's this patient. And so there has to be a two-way interface. It's talking back and forth to the LIS, constantly, getting the information of all the specimens that have been processed in that are going to need to be run, and sending through all the specimens that are done, all the results that are done back to the LIS. And then you also have the lab information system, then it's connected to the electronic health record system of the hospital, which is on the nursing and doctor's end, or even the patient end, where the patient can see the results, the doctor can see the results, and all that within the chart of the patient. Within data management in the lab, their auto verification is something that some labs do and some labs don't. If you have auto verification in process, basically once the testing has been done on a specimen and there's nothing wrong with it, everything went fine, it's correlating, or it's if it has previous results, it's matching up, there's just really no red flags. It just sends it on straight to the LIS and straight to the EHR, and the tech doesn't have to do anything to it. If you don't have auto verification in place, and every test results that come off that analyzer has to be verified into the lab information system before it can be sent to the charts. So that's a time-consuming process. Also, if you're not right there at the analyzer and you have to walk away to deal with another problem in the lab, and you have results that are ready, and even if they're just normal, they could be just sitting there on that analyzer on the printout for like 20 minutes until they are verified manually into the system. They don't go nowhere. So auto verification does speed up the process by getting those results straight to the chart, but unusual or critical results are always reviewed. They're never auto-verified because you don't want to send erroneous stuff to the chart, so a tech have to lay their eyes on it and make sure that that's actually valid before it's sent on to the LIS and then into the patient's chart. Because the last thing you really want to do is have a result hit the chart and then having to retract it or correct it, which it can be done, but then you have that kind of that misinformation that's already floating around, and it's just, you have to be able to recall all of that and modify it and stuff. Next little poll question: which of these is or are part of the data management phase of automation? Select me an answer. And then we're going to talk a little bit about total laboratory automation. So the total laboratory automation involves automating the pre-analytical phase, the analytical, which is widely already been automated, and then the post-analytical phase. So in the pre-analytical phase, which has been really where a lot of progress has been made in this total lab automation, is it takes care of centrifugation, decapping, and then aliquoting would be like if you needed to send it to two different analyzers, but you only had one specimen, then it can actually take some of that specimen and put it in a different tube, which then gets labeled, and then one goes one way, the other goes the other way to the other analyzer. And that's aliquoting. And of course, the analytical portion has already been widely automated. And then after that, all of these samples that are on that analyzer, if you don't have total lab automation, usually the tech has to remove them from the analyzers, recap, and then storage. And so the post-analytical, that can be automated, so they can be automatically uploaded from the analyzer, recapped by the total lab automation system, and then stored. And then this is the advantage here with total lab automation. If you have a post-analytical system like that, is that, let's say you ran a specimen, chemistry maybe, you ran a comprehensive metabolic panel on it, and then a few hours later the physician orders a thyroid panel and it wants you to do it. Then it wants you to restrict the patient and wants you to do it on the lab, the blood that you have down in the lab. And you're like, sure. Well, if you don't have one of these automated systems, then what you have to do is you have to look through all your specimens that you've run for that day one at a time to find that specimen, to make sure that you don't pick up the wrong one, you don't misread the name, and you have the right one that was collected at the time that, maybe it's the morning run or whatever, like whichever one you want to add the test to. And that can be a time-consuming process, whereas if this is automated, it knows where it's at, and you can tell it, find Mr. Smith's sample from 8 a.m. and it will go, and you can search, it's searchable, and you can find it, and then it goes and picks up the tube and then sends it back through for testing on whatever it is that you programmed it. So I'm going to open this web page, and so this is an automation here for from Siemens, and we think okay, and I do believe okay. This is what I wanted to see, the automation. So they added automation, this after automation in this hospital to help with their system. So I'm gonna, this one is, you're gonna have to watch it through your pod, but I just want you to see kind of what it looks like here. And so they're using Siemens stuff, the dimension, the reagents, and all of that. And so they decided to automate the lab. As you can see also in the testing process what's come in, what's done, what's in process, how fast things are flowing.
Prior to getting the Singo Lab inventory management system, we monitored our inventory manually.
So it helps with inventory management, it helps with specimen management and all of that. So further in, see what it looks like. It's showing a little bit more in the system. See, show.
Once we implemented the SLIM system,
you can see it's kind of, it seems like a long assembly line, and everything is like connected, and then specimens can move back and forth between the different types of analyzers and the storage analyzer and all of that. And so you can, this is cartridges and stuff like that going in. So anyway, this is one of the ones. Here's another one. Let's see if I can.
North Memorial Healthcare has many different parts of the reference laboratories.
I'm going to try to fast forward it. I want to see. Okay, here we go. We can see it moving through a little bit. So you can see how it moves through the system with barcodes. And you have all the analyzers are like linked to that system. And the specimens are moving back.
Some of the unique benefits to going with the Siemens platform is
so
their
that can give you an
Actio,
idea of, and so in this kind of specimen processing system, you could load, coag and hematology and chemistry and all of that, and it just distributes it to whatever, system that it needs to go to. If it has to be centrifuges it and all of that, and it just sorts everything out to where it needs to go, and then you can get great turnaround time and all of that. So that just kind of gives you an idea of a little bit what automation looks like, or total lab automation looks like. So here you go. And that was the last slide, the end of the lesson. And so if you have any questions, if you're in my class, you can put them there, or you can email me, or you can drop them in comments, and I'll do my best to answer them. Thank you.